Welcome to a new episode of MoCapLab TALKS. Today from the Institute of Functional Diagnostics from Cologne, Germany. We are having a very special guest here today. She's working half of her life in the field of motion capture and biomechanics, even though she's still very young. Thank you. You're welcome. She's very experienced in the transfer of the results of individual biomechanical analysis into relevant therapy and training interventions. And she's a part of a team that, without any external funding, makes a living from functional biomechanical analysis service. Tanja Esser.
Yes, hi. Nice meeting you.
Thank you, Tanja. Good to be here.
Yeah.
Thank you for having us. Tanja, I don't want to reveal how old you are now, but you started working in the area of biomechanics at the age of 19.
Yes, that's correct.
That's remarkable. What did drive you towards biomechanics at such a young age?
Yes, I wanted to study biological engineering at the end of my Abitur, and therefore I needed an internship. So I called to the Sports University at the Institute of Biomechanics, Dr. Gerd Peter Brüggemann, and that was my way to get into the biomechanic field. And
you called him and you could...
Yes, we met, and I was really exciting because I was 19 and there was Professor Dr. Gerd Peter Brüggemann in front of me. But I liked it. I liked it a lot, and he showed me all the laboratory. Of course, I had some information before about it, and I really was interested in coupling technology and biology, and with humans. So,
what were the first projects you were involved with?
The first one, yes, I remember this. It was Salt Lake City Olympic Games, Winter Games in 2002. And we wanted a kinematic analysis of ski jumpers in Salt Lake City. So they put several video cameras along the jumping hill, and I was the one who had to digitize all the ski jumpers. That was my first project.
With which software was it?
It was with Peak Motors.
Yes. I remember that one.
Yeah.
A lot of clicking and
hours back
then.
Yes, since then I need some glasses.
Really?
I didn't use it before, but then hours in front of the computer, then I knew, I think I need some glasses.
And you also told me about some very remarkable projects.
Yes.
Can you name a few?
Yes, I remember one project, I call it the bra project, and it was to develop new bras to protect oversized breasts, and of course we had to do a motion analysis, and the women had to run in different bras. They had to jump in different bras, and I remember that. And another project was the deodorant project, and we wanted to analyze how much deodorant someone put on their skin, where they put it. I remember this because every test person could bring their own deodorant. So, yeah.
I was a subject too.
Yes, you were. Which did you bring?
I don't know the name.
No?
But the lab was quite...
Yes, smelling. Yeah.
So, you have used biomechanical measurement tools since 17 years now. What has changed in terms of the usability of the technology?
Of course, it's getting faster. I remember, as I said, with Peak Motors, of course, we had to digitize all anatomical marks. And then I remember my first project with Vicon workstation. We didn't have any live view, and the post-processing, it costs a lot of time to fill all the gaps, to label, and we didn't have any live view, so we couldn't see are we measuring correctly. We could do this afterwards, so this is quite faster now.
I remember with Workstation that you couldn't even, during the measurement, you couldn't even see what you were measuring.
Yes.
Yeah.
Yeah. So
Only
we had
afterwards.
we had this database where you could put all the details of the measurement. Could be okay, right? I don't know. Take a look afterwards. So we had to catch several trials to make sure that we have enough. This is quite easier now because it's faster, of course.
Yeah, yeah. It's a lot of time.
Yeah.
First, you started working in a research environment with studies, larger patient groups or subject groups, and here at the IFD, it's a different approach.
Yes.
If I got it right, it's all about the individual biomechanics or the biomechanics of the individual patient or subject. What is the idea behind the IFD?
We use the biomechanical technology, such as motion capture systems, force plates. We have plantar pressure distribution here, platforms. We use strength measurements like isokinetic or isometric tools, EMG, of course. So we use all these biomechanical technologies to find functional or biomechanical causes of overuse injuries. So we work in the orthopedic and sport medicine chapter of medicine. I started in the neuropediatrics, which many people, I would say, know. There are a lot of gait laboratories who work with children, and we work with patients who have arthritis, who have patellofemoral pain syndrome, muscle or tendon strain injuries, and we try to find biomechanical causes for their injury or problem.
That's amazing.
Yeah.
Who's your typical client or typical patient that you have here?
Our patient or our client, we have, I think, 4 different fields. One of them are the typical orthopedic patient. The second field is sports people, sportsmen who play golf, or they are runners. They want to improve their technique, maybe. Or we have the elite soccer players. We do performance tests, biomechanical performance tests. The third field is after operation or after an injury. So you come to the phase of recovery, and we do criteria-based return to sport or return to work, depends on the question. And another part is clinical research. This is also one part we do here.
Yeah. Okay, you're also doing research here. In the
Yes.
institute.
Yes, a bit.
I guess it's a challenge to communicate the outcome of the biomechanical analysis to the corresponding therapists, medical doctors, and sport coaches, for instance. How do you deal with that?
Yes, at the beginning it was really hard because we had to find a language where we meet. Doctors are speaking differently than physiotherapists or orthopedic technology specialists. And of course, when you come into this field as a biomechanics specialist and you talk about joint moments or you talk about stiffness, that's new for them, and that was very challenging to speak the same language, because we all have the same goal. We do biomechanical diagnostic. The doctors tries to find the structural diagnostic, of course, and the therapists and trainers, they have to work with it. So I think the first 3 years of the IFD, we really had to find the correct language that it would be the best for the patient, because that's what's the goal.
You told me that you offer workshops, educational workshops on the interpretation of the biomechanical analysis results.
Yeah.
How do you organize that? And I think that's a great idea.
In our workshops, we showed them with Qualisys, with the live view, and that was quite nice. We could show them how different training tools, for example, if you do a squat and you use some weight, or you don't use weight, or you put your back upright, or you lean it forward, how it changes the load. For example, for the knee. We could show them, and we could show the force vector, and this is the center of your knee, and that was quite good, because they really understand what we are doing in this way. And then we put some words like joint moment. So this is the joint moment. Yeah, and this was really good. Yeah, to
so you're using the video overlay.
Yes.
In the
in the workshop we use the video overlay. Also, when we show this to the patients, we use the video overlay of Qualisys, which is quite good, because if you just show graphs, or if you just show an animation, they really don't understand it's you, it's the patient, it's your knee. That's very good to explain.
Yeah. So that the patient or the client can relate to what they're seeing.
Yes, and they understand it, and then they understand, and now I have to train, for example, more core stability, because this affects the load of my knee.
Okay.
So we can show this directly, and that's quite good.
So you have a client coming now.
Yes.
Can we join the assessment if everybody agrees?
Yes, of course.